Okay, so let's go into the specific chapters for the evidence of coverage. And we're going to continue to use the Blue Cross All Kind of documents. If you missed how we got here, please go back and watch the intro video for the EOC. In that particular example, we used a Blue Cross plan. It was one for total Midlands coastal. This one that I marked this one here that I have got marked up for us for this video is going to be the total low country. It is literally going to be the same format. Some of the information, meaning the plan details, are going to be different, but everything else is going to be the same. So whenever we pull up this document, we immediately see our title page. We know that we're in the 2024 evidence of coverage. We have what our plan name is, and then we have what's very important here to make sure that you're in the right year is going to be January 1st to December 31st, and you have all of your contact information and what times they are available. All right, so let's scroll on down and we recall this page. So we're not going to go through any of this stuff that we've already gone over. We're going directly to chapter 1 to talk about how we get started as a member, and chapter 2, the important phone numbers and resources. So let's remember that we can click within this document and it's going to take us directly to where we clicked. So let's get started with chapter 1, getting started as a member. I have some sections highlighted, some things that I want to call out. So what you're going to see in section 1 is an introduction. And basically what we're trying to get across here is for you to see that you're enrolled in a particular plan. So this says you're in the Blue Cross Low Country. It's a Medicare PPO plan. You get all of that information from this section. It's going to tell you that this means that this health plan that you're in has been approved by Medicare, and that PPO stands for Preferred Provider Organization. Okay. Then you're going to go down. It's going to tell you what is the evidence of coverage. What is this huge document? What are you actually going to get out of it? And it basically tells you that how you're going to get your medical and your prescription drugs, what your rights and responsibilities are, what's covered, what do you pay, how do you file a complaint. All of that information is what you're going to get out of the evidence of coverage. Section 1.3 of Chapter 1 is all legalese. What's some of the legal information about the evidence of coverage? So basically, it is a contract. You signed up for this particular plan. Here's the contract about what they are actually going to cover as far as your care is related. Okay. It's telling you also that sometimes these notices are known as riders or amendments, meaning the supplemental documents that come with this, like your list of covered drugs, also known as the formulary, your pharmacy directory, all of those documents that come with this particular contract, or this EOC, is everything that it's telling you in section 1.3. In section 2, again, of chapter 1, because we're still in chapter 1, it talks about what makes you eligible to be a plan member. So you've selected this plan, you've been enrolled in the plan, you've been accepted. What do you have to do to continue to stay? So in order to be in this type of plan, you have to have both Medicare A and B. Okay, so remember, you cannot be in a Medicare Advantage prescription drug plan unless you have both A and B benefits. You also must live in the geographic service area of the particular plan. It tells you to see section 2.2 so that you know what that service area is. This is important because you may move from one part of the state to another part of the state. And if you do, you may no longer be eligible to stay in this particular plan. And then the third bullet says that you have to be a U.S. citizen. All right, section 2.2 is the plan service area. So it's basically saying if you're in this particular plan and you're in South Carolina, you have to be in South Carolina in one of these 5 counties. Okay, so that's what this is saying right here. My highlighting's not working that great. So basically, this section is just laying out the service area. Section 2.3, again, you have to be a U.S. citizen or be lawfully present in the United States. Section 3 is going to go over all the other documents that you're going to receive. So your membership ID card. And I always like the fact that they give you a sample of what your card may look like. So here's what your ID card should look like. And it tells you here, do not use your red, white, and blue card for covered services because remember, once you're in an MAPD plan, you are now getting all of your original Medicare, meaning your Part A and your Part B benefits through this Medicare Advantage prescription plan. You do not have to use your red, white, and blue card any longer. You're also going to have your provider directory. So if you want to know how you can find your providers, meaning your physicians, the hospitals, then there's a provider directory. How do you get that provider directory? You can go directly to their website that we were at earlier, or you can actually call the customer service number and they will send you one within 3 business days. You're also going to get a pharmacy directory. All right. This pharmacy directory is going to list out the network pharmacies. And that basically means what pharmacies can you actually visit to use your ID card to get your prescription drugs. If you need a copy of that pharmacy directory, you can go to their website again, or you can call customer service. The formulary, which is the list of covered drugs. Again, what drugs are covered, how much are you going to pay for those drugs, what tier they're on, all that stuff's going to be in the formulary. So that's another document that comes with this EOC that you can get online or you could call customer service. Notice how it tells you can call customer service and you're like, well, what's customer service's phone number? Well, you can get the customer service phone number off the back of your ID card, or remember at the top of the page, on the title page, it has the contact number information here, as well as in this section right here. There's the customer service number. So there's several ways that you can find customer service number. And we're going to see in section 2 that it's also going to be there as well. So this section 4 is all about your premium. What do you have to pay per month for this Medicare Advantage prescription drug plan? It's also going to go over other things like not only your plan premium, but maybe you have a Part B premium, which everybody does unless you qualify for savings, and then you may not have to pay that, be responsible for your Part B premium. Part D late enrollment penalty, meaning you did not sign up for Part D when you were first eligible and you did not have credible coverage for at least for a gap of more than 63 days, or you're a high income earner and therefore you're subject to IRMA, or income related monthly adjusted amount. All of that information is going to be covered in this section. Also talks about if you get extra help or low income cost sharing, you may have an LIS rider. And it's basically saying that if you meet certain income requirements, you may get assistance in paying for your prescription drugs. Okay. It's saying Medicare Part B and D premiums, they differ for people with different incomes. You can look at your Medicare and You handbook for more information. You can go to medicare.gov, or actually also gives you the Medicare hotline phone number. Section 4.1 says if the plan premium for this plan is $25 per month, the Part B premium, you're required to pay your other Medicare premiums, meaning your Part B premium, okay? Late enrollment penalty, we talked about that. 63 days or more without credible coverage, without signing up for a Part D plan, you're going to be subject to that late enrollment penalty. And then it tells you when you may not have to pay that late enrollment penalty, or LEP. And so we keep going, and it gives you this right here is a cool section. It's actually going to tell you how to calculate that penalty, and that will be in a separate video because I don't want this to be super long. I really just want you to know what you can find in your evidence of coverage in chapters 1 and 2. And then we go into the income related IRMA again for your high income earners. And then we move into section 5, just more information about your premium, because now you need to know, okay, it's $25 a month, but how do I get it to the plan? Well, you can mail it to this address, you can drop it off to this address, so it gives you all of the options, including you can have it withdrawn automatically from your Social Security check if you would like to. Section 5.2 is basically asking, can we change, meaning the plan, your monthly premium throughout the year? And that answer is no. And it says we will tell you in September if the premium is going to change for the next year, and that has to we have to let you know that in September, and the change will take place January the 1st. And I have a call out here that what happens is you can find this information in the ANOC, which is the annual notice of change. The change in premium year over year is a key component of the ANOC, or annual notice of change, that plans must have out by September the 30th before annual enrollment period for the next year. Section 6, still in Chapter 1, is how do you keep your plan membership record up to date? Basically, they just want you to let them know if your phone number changes, if your address changes, if you're now getting a workers' comp claim, or you have a different third responsible party that you want to be over your account. Please call in to customer service to keep that updated. And then we move on to Section 7 that just talks about how this insurance works with other insurance that you may have. So you may have decided to continue to work and you have insurance through your employer, but you also wanted to pick up this particular plan. Maybe you like the prescription drug benefits, or you wanted to have additional coverage with physicians. Whatever the case may be, that is called coordination of benefits. It just gives you examples of when your Medicare Advantage may be primary versus your other healthcare coverage may be primary. So that is everything in Chapter 1 as you get introduced to your particular plan. And then in Chapter 2, it's important phone numbers and resources. This section is important because, as you noted earlier, it kept saying call customer service, contact customer service. So you can go back to the title page to find out some of this information. However, Section 2 is all about important phone numbers and resources. So you see in Section 1, it tells you here are the contacts, how to contact us, including customer service. It gives you how to call in if you are deaf. Then it has a TTY line, a fax, write, and website. So all of this information here. And then it breaks it down. If you have a coverage decision or appeal about your medical care, who do you contact? And how do you do that? If you have a complaint, who do you call and how do you contact? If you think the plan should pay a part of a medical care or drug that you received that they did not, this is how you get access to the plan to tell them that. Then they give you information for how to contact Medicare directly, state health insurance assistance program. So the QIO, or Quality Improvement Organization, that information is there. And then if you need to contact Social Security, which would be who you would want to call maybe to see if you qualify for low income cost sharing, you can go into that section and find their information. The state Medicaid office, these are the programs that help pay for your Medicare Part B premium that we talked about earlier. So if you wanted to go directly to Medicaid and see if you qualified for any of these programs, here's where you would find that information. And then Section 7 talks about everything around extra help, and it gives you the same phone numbers like for Medicare, the Social Security office, and your state Medicaid office all in one spot. Then Section 8 is maybe you're getting benefits from the Railroad Retirement Board. You need to know how to get in contact with them. That's their information. Then do you have group insurance or health insurance from an employer? If you do, remember you're going to have to call that group benefit administrator. So they will not be able to tell you and list in this section who that is because they will not know. And I just want to call out here that this section tells you how to contact the plan. You notice a lot of these numbers were the same. And that tells me that this is going into their internal customer service. However, you may notice some of the plan numbers were different. And in those cases, that may tell you that there's a vendor, maybe like the prescription drug side. Instead of calling the plan directly, you may be calling the pharmacy benefit manager or PBM to help with those things. So whatever the case may be, if you're trying to figure out who you're supposed to contact and what those contact numbers are, you're going to go to Section 2 of the EOC. So we hope that you will stick around and check out chapters 3 through 12. Please do not forget to subscribe to this channel. Also hit the notification bell so you know when new videos are posted, as well as like this video and comment below if you have any questions about chapters 1 and chapters 2 of the evidence of coverage.